Today we have one of my old patients who is back here for a lower body lift consult. Previously we did her arms, and she now wants to learn more about a lower body lift and a thigh reduction. Okay, well, you tell me, what bothers you?
All my legs.
Let me turn you around.
Yes.
Okay.
My legs here, from here down, this area,
Okay.
this area, and my butt.
And your butt. So when your front bothers you and your back bothers you, then you're gonna need a lower body lift. There's no other way to do the front and back without a lower body lift. And in addition, the most effective way to lift your thighs up is a lower body lift again. So our patient has previously had a tummy tuck in 2007, many years ago, before I was born, no, just kidding, by somebody else. And she knows that she needs to have it revised again because she has a lot of loose skin. So what we'll be doing is we'll be cutting her old scar out and actually pulling the scar lower, coming here. And as I come here, I'm gonna do a thigh front lift for her. You don't have to move, sweetheart. Just go back, yeah. Like that. So on the front, this is, yeah, you wanna help? Awesome. This is what we wanna do on the front, which is a thigh lift in the front and a tummy tuck redo. And in order for me to get this, I have to cut her on the front of her thighs and pull everything up. As I'm pulling this up, I'm actually suturing the thigh tissue back to the pubic bone here. So we feel the bone here, and then we take sutures that anchor the elevated thigh tissue back at a higher place. So we use a lot of anchoring sutures to hold tissue in place. And then you can let go. And then we'll be bringing the incision here. So now we are on the outer thighs, and then we'll be lifting the outer thighs. And up here, I'm gonna be cutting all of this waist skin. So like this. So far, our lower body lift has waist skin excision, outer thigh lift, thigh front lift, tummy tuck redo with abdominal muscle tightening again, and removing the extra lower abdominal skin as I'm lifting this up. So these incisions come together, and I use the tummy tuck incision to hold the front of the thighs as well as anchoring the whole thing down to the bone. That's how you keep it in place. As we come to the back, which is actually where we start the surgery, what bothers her is her lower back skin. And you see all the wrinkles, or what we call rhytids, and her previous extended tummy tuck incision. The other thing that bothers her is buttock sagging, also known as buttock ptosis. So our incisions, which actually get started on the back, go to the front, and this is what we'll be doing. Cutting all of this, lifting the buttock tissue and placing it at a higher position, removing the lower back skin. And in her case, she wants her buttocks to be rounder and fuller. So we'll be taking the fat in between our cut skin and utilizing that fat like a flap to augment the buttocks. So we use this lower back fat in between the upper and the lower incision. We'll remove the skin only and use the fat based on its own blood supply to augment the buttocks. This fat doesn't die. This fat has its own blood supply. So it's not a Brazilian butt lift where you're injecting the fat. This is actually a pad of fat that is rotated and placed back into the buttocks over a pocket that I create over the muscle. So we create a nice pocket here, move the fat into the pocket, lift the buttock over it. So it's a buttock lift with buttock augmentation with lower back tissue or your own fat. And that's what constitutes our lower body lift. My lower body lifts are very comprehensive. It's a procedure that I do routinely once a week at times, and it's not the same as a belt lipectomy. It's not the same as a circumferential abdominoplasty. is far more comprehensive than those two procedures, and therefore I don't use those terms synonymously with my lower body lifts.